1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14,
Attach
15,
pads to
16,
patient's
17,
bare chest.
18, 19, 20, 21, 22, 23, 24,
I got the AED.
25,
Keep the
26,
compressions going hard and fast while I hook it
29,
up.
30, 1, 2.
You've learned how to provide compressions and give breaths to a child. Now we'll cover how to use an AED. AED stands for Automated External Defibrillator. It's a machine with a computer in it that can detect abnormal cardiac rhythm that requires treatment with a shock. The AED can then deliver that shock to eliminate the abnormal rhythm and allow the heart to start beating again normally. If possible, use an AED every time you provide CPR. Use an AED as soon as it arrives. CPR in combination with using an AED gives you the best chance of saving a child's life. AEDs are safe, accurate, and easy to use. To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you'll hear prompts telling you everything you need to do. AEDs can be used for children and infants. Many AEDs have pads for children, or a child pad cable system or a key. If there are no child pads, or if there isn't a child key or switch, use the adult pads. Also, if the child is 8 years of age or older, use adult pads. When you put the pads in the chest, make sure they don't touch each other. If a child is very small, you may need to put one pad on the child's chest and the other on the child's back. When in doubt, follow the pictures on the package or pads. Attach the pads and the AED will tell you to plug in the connector. The AED will analyze if the child needs a shock and will immediately give one or tell you when to give one. Make sure no one is touching the child and let the AED analyze. If the AED recommends a shock, it will tell you to stay clear of the child. Loudly call out, "Clear!" Look to be sure no one is touching the child just before you press the shock button. As soon as the AED gives the shock, immediately resume chest compressions. Let's review all you've learned about child CPR. In a moment, you'll have a chance to practice yourself. First, make sure the scene is safe. Tap the child firmly on the shoulder and shout, "Are you okay? Are you okay?" Shout for help and shout loud. If someone arrives, have that person phone 911 and get an AED. If no one arrives, phone 911 on a nearby phone. Check for breathing. Scan the child's upper body for 5 to 10 seconds. If there is no sign of breathing or the child is only gasping, begin compressions. Make sure the child is on a firm, flat surface. Move clothing out of the way. Place the heel of one hand on the center of the chest. If you can't push down to the depth of about 2 inches with one hand, use 2 hands. Push hard and push fast. Push straight down on the center of the chest about 2 inches. Push at a rate of 100 to 120 compressions per minute. After each compression, let the chest come back to its normal position. Keep compressions going until help arrives or the child responds. Push hard and fast in the center of the chest. After 30 compressions, quickly give 2 breaths. Do sets of 30 compressions and 2 breaths. Remember to give the 2 breaths in less than 10 seconds to minimize interruptions in the compressions. If no one has come to help and you don't have a phone nearby, after 5 sets of compressions and breaths, leave the child to phone 911 and get an AED if available. Return to the child and use the AED immediately. Make sure the scene is safe. Tap the child on the shoulders and shout to see if the child is responsive. Shout for help. Tell whoever comes to phone 911 and get an AED. Check for breathing. Scan the chest for 5 to 10 seconds. If there is no sign of breathing or the child is only gasping, begin compressions. Move clothing out of the way. Put the heel of one hand on the center of the chest. If you can't push down about 2 inches with one hand, use 2 hands to compress the chest by putting the heel of your other hand on top of the first one. Push hard, straight down, at least 2 inches. Push fast at a rate of 100 to 120 compressions per minute. After each compression, let the chest come back to its normal position. When you finish doing 30 compressions, give 2 breaths. Open the airway. While pushing back with your palm to tilt the head back, lift the jaw to bring the chin forward. Pinch the nose closed with your thumb and forefinger. Take a normal breath. Cover the child's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, look down at the child's chest to see it rise. Do 5 sets of 30 compressions and 2 breaths. Remember to give the 2 breaths in less than 10 seconds to minimize interruptions in the compressions.